He is a diplomate of the American Board of Veterinary Practitioners, having graduated from the Purdue University with his DVM, and he is ABVP certified. Without further ado, to continue again on how to increase resilience in our pig farms, especially now we're going into the more practical aspect of it, talking this time on two aspects, management and pig flow. Without further ado, let me give you Dr. Thomas Gillespie.
Thank you for those kind words, Carlo. It is my pleasure to be back in this wonderful country, Japan, the land of the rising sun. I have very fond memories here. As you have determined today, when it comes to biosecurity, it has to meet things on each site. And over the years, we've layered in different aspects. So at the end of my presentation, I'm going to show you the most recent findings and technique that we are using in practice today. You've heard this term virus load. We're going to talk about reducing that wild type virus, the load of that virus, within a site. We've also talked about, to some degree, the high level of coordination, cooperation that everybody has to come to the table with. That's the owners, that's the veterinarian, or veterinarians in some cases. That is every employee. It only takes one mistake, and you can change the health of a farm. The 5-step process, we're using that, and it was developed for PRRS, but we're using that for other pathogens as well. So identify your goal, determine what the current status is, that's through the monitoring program. What are the risks? That's your internal, external biosecurity. Also, look at what techniques we can use to implement and control. And then we, like a previous speaker says, we got to monitor, monitor, monitor. So how do you build a biosecurity program? Well, you start with a concept. What is going on in that site? Looking at how close your neighbors are, what's going on in their farm, so forth. And then you start to build that into SOPs, the mechanical part of that, biosecurity. And that takes a lot of training and monitoring. Every month when I'm on some of my sites, I'm working with the employees to reevaluate. Are we doing it right? Are we doing it consistently? And then the very last part is the organizational part. That's the overall aspect. And so we're going to broaden our thoughts today from just a site out into a whole system. And then I'm going to put some different words on internal, external biosecurity. Biomanagement is both your internal and external. Your biocontainment, that's what you're doing with internal biosecurity. And bioexclusion, that is the external. That's keeping it out of a unit. So again, when it comes to biosecurity, it's got to be realistic. We cannot come to the table at any site if we don't have a program that's realistic and sustainable. And then it's got to have some cost benefit to it. We've seen some of those costs today, and as health changes over time, some of those costs will change as well. When we talk about viral load, this is helping build that mind picture when you've got any one of these viruses breaking on your site. You've got virus everywhere. It's in the environment. It's in the animals. That's the two areas of resiliency that I'm bringing to the table today. And so I term that our viral load. And we have to, in a control program that may move into an elimination program, we've got to reduce that amount of virus on that site. Let's take a disease that in 2013, 2014 really did a lot of economic damage in America. We lost somewhere 4.5 to 6 million pigs. How do we approach PED? So you're going to have a term, what was the production level prior to the break? And then when the break occurs, what are the steps that we put into place? First was to get a positive diagnosis. We could get that in most cases within 24 hours. We'd already started the management aspects as well, and that is to find enough gilts to load and close that site, that sow farm, for at least 3 months. We were guessing at the early stages. We went 4 months initially. And then we want to divert flow. That's part of the management aspects that we talk about. And diverting flows like these gilts. We're going to load and close the herd. We're not going to bring any more gilts in because we want to build that immunity all through the gilts and the sows. We did that through exposure, and we found out very quickly that these little pigs really give us a lot of virus. So the next 2 weeks, roughly 2 weeks, is building that overall immunity on that site. And then we go into our biocontainment. We do everything we can to start reducing virus on that site. And we do that through cleaning, disinfecting, removing feces, removing dead pigs, all the things that you guys know already. Then, the most important is, and our goal was to eliminate the virus from the site. And we were successful in doing that if we got the immunity right and the internal biocontainment right. Well, those same principles will apply to other pathogens as well. So let's take a look at the infectious chain a little differently than we've seen it in the past. But we're going to talk about replacement gilts, and how they influence, and how we build that immunity in them, how they influence that sow herd. And of course, whatever's going on in the sow herd gets carried right into farrowing. And then if those sows are shedding, they're going to give that pathogen to their offspring. And then that impacts grow finish. So this is horizontal transmission first from gilts to sows. Vertical transmission is sows to offspring. First, I'd like to start with mycoplasma. And what we know about mycoplasma today is it's a very slow transmission from one pig to another pig. In fact, we are working on ways of actually moving that point of infection down and trying to control it. And it's very difficult, but we think we've stumbled onto something there. But if we don't infect this population at the point we want to, then some of the pigs do not get infected until 170 days of age. Well, we know today that this kind of animal will shed for 240 days, give or take. So that means she's going to be shedding organism to her offspring in the farrowing crate. Where the first animal that got infected early enough probably will not be shedding to her offspring. And we know that, and so that's how we're building our control and elimination programs on mycoplasma. Now, what that means is that if we don't control it and infect that gilt early enough in the GDU or isolation, then it's going to transmit to its offspring, and then the offspring's going to transmit and show us clinical signs around 3 months of age, give or take, in grow finish. It can be earlier if you got co-infections. It can be a little later in some cases. So when it comes to PRRS, the thing that really you have to remember on transmission is when that naive animal gets infected, it's going to be viremic, as previous speakers have talked about, but it is shedding that virus from about every opening in that animal. The tears, the urine, the feces, boars that'd be in the semen. So how do we control that? That's the key. We practitioners have to understand pathogens. Each pathogen is slightly different. And then we have to put control modules in place. And then as the indirect transmission, the vectors, the fomites, and Dr. Satoshi added feed with our most recent understanding. It's some studies that Dr. Scott D has performed, and it shows clearly that some of our viruses can live in soybean meal for many days. And that's one way how they get transmitted around. So back to pathogen transmission, we're going to talk about PRRS again. Our goal in America is to be able to wean a pig that is negative on PCR. Now that can be off of an infected sow, a sow that is trying to remove that virus from her body, but she's not shedding it. And that's one of the main steps in our control program. So we are working on the immune aspect in the gilts and getting them at the same status as the sow through time and modified live vaccine. And again, our X tells us that we want to wean a pig that is free of the virus so that when we vaccinate that pig at weaning, we get the best performance out of the vaccine. So let's talk about some resiliency, and I mentioned this already, but I look at resiliency in the environment and how we impact that environment, but then also the animal. We've talked enough about the animal. In this case, this young man has walked in the entry door to this unit. The rug is beneath his feet, his shoes. He takes his shoes off, swings his feet around. They do not touch the floor on the dirty side. He swings his feet around and he stands on the clean floor on the other side. In this particular case, we then shower into the unit. It's a 4200 breed to wean unit. Now I'd like to apply the principles of reducing virus and improving immunity as well as diverting flow in a single site. Now it doesn't matter to me, these same principles apply on monocytes, single sites, if you want to call them that, or site 2 and site 3. It's the same thing. What do you do if that farm becomes unstable? Well, first, the normal flow, sows go into lactation, lactation weans pigs into the nursery, they move into finishing, they go to market. In some of your flows, you're going to take gilts out of the finisher and you're going to put them back into the salad barn. Others are going to purchase gilts. Now, if we have an unstable sow or an unstable site in this case, we're going to stop movement into the sow herd. That's called load, close, homogenize, or expose. And we know we need enough gilts today for 7 months. The next thing we're going to do, and this is where I get pushback on a single site, but you need to vaccinate every animal on that site. The piglets don't need it until they're around 2 weeks to 3 weeks of age. But anything over 2 weeks will get a vaccination. And we don't vaccinate the last 4 weeks of animals going to market. But everything else gets a vaccination. So now what we're trying to do here is homogenize the immune status throughout the site. Our maintenance program is continuing to vaccinate the sow, and we're going to vaccinate the piglets. Now, the next step that we do is monitor the piglets at weaning with serum. We'll bleed 30 piglets at a time, sometimes more, up to 60, depending on the size of the sow farm. And we'll pick random pigs out of different litters, and we'll usually pick on the smallest and sometimes the barrel. We do that before we vaccinate the animals because we want to monitor, is any of the pigs still positive for virus? We use PCR. We're doing that to say, okay, is the sow herd stable and no longer shedding? We've got a slight modification to that program that we'll talk about at the end of the presentation. So then we put them in, and as soon as we have met the next step of stabilized sow herd, we start to talk about our next management practice, and that's the bubble depop or the partial depop. We've used both those terms interchangeably. We empty the nursery, We only need 3 days after you've cleaned and disinfected before you can start weaning more pigs back in there. And the other question I often get is, how long does PRRS virus live in pits, manure pits? It can be anything less than 2 weeks, and that varies between temperature and conditions in that pit. So now we've got an empty nursery. You start to refill that nursery, which gives me about 7 weeks time that I've diverted flow, so now I have an empty portion of my finisher. And this is where it gets really tough on the internal biosecurity programs. We have to change boots, clothes, between the clean and the dirty. Remember that clean, dirty line picture where the bench? We've used plastic doors, we've done all kinds of creative things to have a change, have clean, dirty change. And we move it right on out the finisher door. And it's been successful, but it really relies heavily on the internal biosecurity program. Over the years, in the last couple of years, we've helped put together these 10 rules that we all have to follow and look at and monitor. Basically, we're looking at animal-to-animal movement, and you've heard a couple of speakers talk about that. What are you doing with cross-fostering? What are you going to do with your gilts? When will they become in contact with the sows? Keeping the finishing pigs away from the sow herd. All of this comes into play, and it's all part of the management aspects of controlling pathogens within a site. So let's get into some of the weeds and talk about what we're actually doing. So a lot of common hallways for us when we built units in the last few years, and I'll show you 2 examples. These carts are used to wean pigs, but in some cases we just throw the pigs in the aisleway, and with boards we move them right out to the trailer. So we've really developed where are we going to clean anything that's used inside, and it comes inside the farrowing room and comes in contact with the animals. We use boot dips with disinfectant in them as we walk in and out of rooms. We've got a hose bib here if we need to hose our boots off. For us in America, we've also have this biodegradable bag that has helped us reduce the amount of time it takes to wash and disinfect containers like these buckets. So the example here is this one doesn't have a bag, but these do. We got to using these bags because I was watching on a farm several years ago, and the bucket was actually touching the outside tractor trailer that was taking the deads. And so that's a break in our biosecurity. So we got to using these, so now they can just throw the bags right out the door. You might ask me, what all do you do inside of a farrowing room? Well, we're trying to keep everything inside this room as one unit. So all in, all out, as best we can per unit. But we still have to farrow sows. We have to assist sows. We have to start pigs, day 1 pig care, but we can do things like don't step in the farrowing crate to do this kind of activity. We can be creative. We can come up with any kind of other equipment that can be easily disinfected. Here is a process cart. You'll see this Ziploc bag with testicles in it. We're doing that in part of our monitoring that I'll get into in just a minute. The castrating blade goes into disinfectants. The needles are changed between litters. When we have virus on a farm, we have strict needle management. And again, I get a lot of pushback on that with clients, but we insist 1 needle per injection. If you go into one of the 10 rules is strict maghreb. Maghreb was first came out of North Carolina to help us control bacterial movement from one litter to the next. Well, under a strict maghreb, we do not move any pigs at all. If that sow has 18 pigs, like in this case, she has to take care of 18 pigs. So this is going to be example 1 on your left and example 2 on your right. Example one is a very old building, old complex, probably around 30 years or so. And so it's had pretty good lifespan. It's a 1,200 sow unit. We have gestation breeding in 2 barns, farrowing with a common hallway in this barn. And the first example we'll show you is what I learned out of this 3 years ago when we were eliminating PRRS, a 174 virus. This is a more recent elimination program. It's a newer unit, it's about 15 years old. This is the isolation barn. And we brought in gilts, and then over the weekend, we carried them in here. We carried the virus into the sow unit before we knew that they were even positive. So again, this is the farrowing barn, and it has a common hallway. In the first example, if I go back to monitoring piglets, we'd been through the mass vaccination, load close homogenation, the whole works on this site, and we're coming down to about, I think it was 26 weeks. And so we would submit 30 samples. We'd have 5 of those samples go into one test. We call that 5-to-1 pooling. And we'd always come back with 1 of those tests positive. The next time it'd be 2, and then it'd be back to 1, and we may get a negative. And so one day I called the owner up and I said, Evan, my hypothesis is we're moving this virus around. So the first thing we did was bleed pigs that were about 3 days old, and they were all negative. So this supported my hypothesis, meaning that the sow herd was stable and no longer shedding. So how was virus constantly being moved around in those older pigs before we weaned them? Well, when you wean 1 time a week, it takes more hands, more people than the farrowing staff. So you bring people from all over the unit to come in to those rooms that you're going to wean the pigs. And usually this activity is a hurried up, let's get her done, the trailer's here, trucker wants to get those pigs to the nursery or the wean to finish barn. So that's what we do. We hurry up and get all these people there. And then what happens? People go back to doing their job to finish that day's activity. And what we found with the help of the staff is we were not cleaning the hallway fast enough because we were running these pigs down the hallway, we contaminated the hallway, and then as the people went back into the farrowing rooms, we carried virus right back into the rooms. As soon as we put in the strict internal biosecurity, we contained the virus, and they've been negative ever since. This is a new technique that we started this summer. As you can see, the first column is a 1,000-day date for those that use 1,000-day. We put in the actual date in the second column. The third column, going left to right, will be the number of litters that day. So this is what we're calling process day fluids. There's 2 techniques being used right now. One is to collect all the testicles out of every litter that you castrate that day into the bag. The other technique is to use tails and testicles. Now for me, I didn't want to know what was going on in the environment. I wanted to know what was in the pig. So I elected to only use the testicle fluid. And we call this process day fluids because all of the litters castrated that day go into that bag. So then we document what litters we're actually working with and working on, what rooms, is it a positive or negative test? We captured the CT value in the next to last column, and then the very last column is the case number at the laboratory. We would only send this week's samples in on 2 days. So we would send them in on Monday for a Tuesday result. We'd send them in Thursday for a Friday result. So we had 24-hour turnaround. So we knew what was going on the following day. And what I'd like you to focus on is in the column with the CT values, we had a lot of positives at the beginning, but not all of them. And then you can see as time goes on, we're getting into July, August, and September in this we're finding fewer and fewer positives. So at this point, now we're into, looks like September, October, and November, we started adding to our program with serum at or near weaned pigs. In this case, we're not vaccinating these pigs, they're getting vaccinated at the nursery. Our goal here is to eliminate, and we kept coming up with these sporadic positives. And we just couldn't quite figure out what was going on. And in the first time that we looked at our daily activities with the manager. And he didn't want to wean some pigs that were very compromised. There was no reason to wean them. They weren't going to be good quality pigs. So they were euthanized at the end of the hallway. Now he knew that we needed to clean and disinfect the hallway and everything well, but in this case, in the busyness of a day, it didn't get done. And the next thing we knew, we immediately started picking up positives in the rooms that were being farrowed at that same time. So I think this is examples, real life examples of how we move pathogens around. I watched in this particular farm one day, excellent staff, really a good staff in farrowing. But one of the ladies was missing. She was there when I first got there to the farm early, but she had a migraine headache, so she went home. And I watched her daughter work, and she was moving between rooms. She was getting the sows farrowed, she was starting the day one pig care, and it was being done correctly. But I think we were too quickly moving between rooms, which again, can move these pathogens around. So if you noticed, we've got time up here, and as time goes along, from the positive rooms 11, 12, and 1, suddenly we had them in rooms, positives in rooms 6 and 7. And so again, we went back and did our homework and found that yes, we were farrowing at that time, and we carried virus into those rooms. And it just continues. Now, I'd like to drive all this home with an excellent talk, and the paper's available to those that are ASV members. Dean Boyd gave the Howard Dunn Memorial Lecture in 2012 to us at AASV. And what he did is he took AgriStat records, so this is records from 68 firms in the United States, and these are usually big firms. So there's a lot of pigs represented here. And he put an economic value on the top 10 areas that he found come to the top. Well, number 1 is post-weaning mortality. Number 2 is market calls. So if you have disease in your grow finish floor that's coming from the sow herd, you know, you've got more calls, less full market value pigs. Pre-weaning mortality is number 3. What have we got in common? It's the number of pigs. That's what drives the economics in these units, is meeting the number of pigs that that owner needs each and every week, or in some cases, each and every batch. So pigs is what's driving all this, and we want as healthy a pig as we can. So to summarize those 10 management rules, you can put them in these kind of categories under biocontainment, pig movement, cross-fostering, people movement, processing equipment, needle management, feedback. Those are the kind of things you've got to look at. And then on the external biosecurity, again, it's anything that comes to the unit that you have control of. So in America, we're building new units. Almost all of them are filtered or could be filtered if a neighbor builds a unit next to them. It's less expensive to do that than to go in and retrofit. We're using a lot of disinfectant mats and other ways, shoe covers, all this kind of stuff to help reduce entry of pathogens. So again, biosecurity, it's looking at horizontal, vertical transmission, understanding each and every pathogen that you want to control. Somebody talked about change a little earlier. Our attitude towards change, I think Sydney hit the nail on the head here. Our dilemma is that we hate change, but we love it at the same time. What we want is things to stay the same, but to get better. We can only do that if we're engaged and we actually take an active role. Thank you very much.